bone marrow, a stem cell. If you get a cut in your hand, it gets healed by itself. Why does this happen? Because of stem cells repair. But as we get older, the same stem cells also get old. They also decrease in numbers, and basically they can't repair anymore. And that's one of the reasons, though there are many theories of aging, but that's one of the reasons why we age. What if we could take a young cell from a baby umbilical cord, for example, and it's a stem cell? We take this cell and we cultivate and make it into millions of cells. And then we take this cell and inject into someone who is older. Now, imagine someone who is 40, 50, 60, 70 years old, whose own cells are old, but now he gets young, cells from a young person. And now this will go into your body, and this will go everywhere and regenerate your organs. There is definitely some benefit in using regenerative stem cell therapies. Of course, I must say you must combine it with lifestyle. Eating right, doing exercise, keeping your muscles strong, sleeping well, avoiding toxins, all these come in play. But stem cells are the add-on. Stem cells is definitely one of the therapies that will help to regenerate and slow down the aging process. Now, what is the procedure? How do you take stem cells? What happens? What actually do you have to do? Now, the moment you agree that you think you need this therapy, it's not just the state of order you're going to get this therapy. First is you come and see a medical doctor, someone who is qualified in doing this, someone like me who will be able to now tell you whether you can or cannot do this therapy. So when you come, you actually get an appointment to see us. And first thing is, of course, we'll go through your whole history to see, what sort of medical issues you have, what medical problems you have, and how you will improve from this therapy. Second, of course, an examination will be done to make sure that, for example, you look at your blood pressure, check, make sure your heart, everything is normal. And then actually do a full medical checkup. That means you do actually a full blood profile, and including some of the things we'll look at is basically all your organ functions and also your cancer markers, because we don't need to have something that's already going on and, then you're not going to get benefit from the stem cells. We want you to get that treated first. So once that is done, and if everything is okay, that means you're ready for the procedure, then appointment will be made. And what I normally suggest is that maybe the day before that, sleep early, have a healthy diet, take a lot of vegetables and fruits, avoid too much of heavy meals like carbohydrates and meat. And then on the day of the procedure, it's a very simple procedure. You will come in and we will put up what we call an intravenous line, where we will then infuse the stem cells. Most of the time we give you about 100 million stem cells, and we expect to give it over 1.5 to 2 hours, and that's all. Any side effects, so far we've done hundreds, apart from maybe some local irritation, never have a problem. And after that, basically you just go back and rest. And again, I advise people for the next 1-2 weeks, have a healthy lifestyle. Avoid strenuous activity for 1-2 weeks, because you don't want you to get too inflamed. Other stem cells will go and start repairing that inflamed area. We also will be looking through your blood profile and all. There'll be certain supplements we will actually advise you to take to support the stem cell therapy, right? And that will vary according to person, but basically this will be the supplements that help you also to make your stem cells more active, make your body more healthy. And after that, you'll have an appointment in another 4 months to see us to just go through and check again.